Okay, back again. Sorry about that, guys.
Thanks again, Mike. Mike's been very generous in meeting me at the clinic and showing me some of what he's been doing fertility-wise, which is terrific because it's Mike and I share an interest clinically in treating women and their partners in fertility issues. Do you we see a lot of patients that go through IVF. What about patients that don't want to do IVF or aren't doing IVF? They want to take a natural approach. How would you kind of differentiate those?
That's a really interesting question. I'll tell you why. Because I just had a patient today, a couple, and this couple's been trying to get pregnant for 7 months. And I said, you're not infertile because the definition of infertility is unprotected sex for a year at the time of ovulation. They've been trying 6 or 7 months, but they were bad shape, man, lots of issues. And I said, look, I'm going to treat you for your general health, but I can't really treat you for your fertility yet. And they said, why not? And I said, well, what's your sperm count? And he didn't know. They didn't want to do IVF, right? They wanted natural means. So I said, well, we can do that, but you might have 0 sperm. I said to the woman, are your tubes open? Do you have endometriosis? What's your FSH? Do you have any polyps in your uterus? I don't know. So I gave them a whole list of tests. Do you have ureaplasma, mycoplasma? I gave them a whole list of tests. And I said, go get these tests done and come back. And I said, if all these tests are negative, I'm going to treat you. You don't need IVF, you don't need IUI. She was like 32 years old. We'll just treat you with acupuncture and herbs. But I said, if you have some pathology, if your tubes are blocked, you must do IVF. But I'll still work on you to try to improve your egg quality. But if everything is good, we'll work on you. If you have pathology, we need to do what works. What is that called? It's called East meets West in reproductive medicine. When you go to a war, you don't just bring a pistol. You bring rockets, airplanes, battleships, men, women, rifles, pistols. You must throw everything at your enemy. And in this case, the enemy is infertility. So yes, I'll treat a patient who wants to conceive naturally, but they first must go through the Western test to make sure there's no anatomical problems.
Does that happen often? I mean, I'm just thinking about my own practice. Patients who come looking for fertility treatment have by and large already, in Australia, already had all the tests, so they kind of know I've got this and that. I'm making a kind of a cognitive decision not to pursue the IVF. Does that happen here, or are you getting people who haven't, as you said, had any testing at all?
No, most of the patients that I see are patients involved in IVF or intrauterine insemination. So it's very rare for me to get a patient who says, I just want to conceive naturally. Because remember, there's a desperation factor. And we are of a Western culture, and we're raised in the context of Western medicine, and the first thing that Americans are going to do is run straight to the IVF doctor. And then what'll happen is some of them will get pregnant, some of them will get pregnant and miscarry, and some of them won't get pregnant at the 3 IVFs. So then they end up coming to me because they want the additional support. And I never tell them not to do another IVF. I say, let's work as a team. Why aren't you getting pregnant? Because you have egg quality issues, or you have sperm quality issues, or you have inflammatory processes, immunological issues, blood clotting issues. Let's work on these things in conjunction with the reproductive endocrinologist and work hand in hand and try to get you a baby.
Yeah, interesting. I wonder, looking at my patient base, whether people are going to IVF sooner than they did. Obviously it's still, I think the first IVF baby turned 30 this year or something like that. So it's
now it's heaven.
It's live. Yeah.
Where are you, honey?
We're meant to be going to Broadway. Hang on, I think what I was getting at was that people seem to me to be getting younger and younger going through IVF. Are you noticing that here? Is there, we talked about trends quickly. Are they getting younger or not?
It's really hard to say. I mean, I must confess, my typical patient is 35 to 40 years old. I've had outliers. You know, I've had 25-year-old patients and I've had 45-year-old patients, but I'm not seeing a trend of younger patients. That doesn't mean that they're not out there. It means that they may not even know that they're infertile because they're not even involved in a relationship. But sometimes you have this disorder called premature ovarian failure, right? And you have women that are 22 years old that aren't menstruating or ovulating. And that's a very bad case. It's a difficult case.
It is difficult. I mean, I often think, you know, in terms of clinical practice, we're often in the medical scheme of things. We tend to be the practitioners who are at the end of the line. They've tried everything, nothing's worked, or nothing's worked very well. They've had a bunch of cycles. I have women who've done 9 IVF cycles and had not a single HCG reading at all. You know, and it's heartbreaking. So we're you know, by definition, treating the hardest cases.
Absolutely.
As a clinician's, you know, from a clinician's perspective, is that a good thing, or is it a...
Listen, practitioners to be, treat back pain. It's a lot easier. No, I'm just kidding. No, I think that it is a good position to be in. It's an interesting question. I think your question is it a good position to be in to be faced with the most difficult cases? And I like that position because that's the time that we have an opportunity to make the greatest change. I mean, you get a patient that's 9 failed IVFs, and if she gets pregnant because of our intervention, that's our ticket to heaven. You know, we've done an incredible service to another human being, and we'll never forget her, and she'll never forget us. I mean, it's a wonderful opportunity. And you know, what we do is truly yin and yang, because we're constantly faced with grief and with joy. You know, we're faced with the patients who never get pregnant, but they do under our care. And we're faced with the patients who never get pregnant and who don't under our care. And so, you know, we have to have thick skin and very gentle hearts. And it's tough to do what we do.
Yeah, I agree. It's a real mix of emotion, isn't it?
Indeed it is.
Those positives are real, they're highs, and
absolutely,
it's a wonderful thing to share with patients. My wife is waiting for me on Broadway.
She's got a shovel in her hand too, so I'm not going with her.
But it's been a pleasure. Thank you so much for
my pleasure,
having me. And you know, it's been fantastic meeting Mike. He's a terrific practitioner. If you happen to be listening or watching this and you're in New York or New York State, then you know Mike's definitely the guy to come to if you're thinking about fertility. Like
everybody's welcome. If you're a patient or even a practitioner and you just want to visit, it would be my pleasure to have you come in and give you a warm welcome and show you around.
And hopefully we can convince Mike to come down and perhaps do some seminars with
us. I would love it.
In Australia.
I would absolutely love it. I may not come back here.
Thanks again, Mike.
Thank you. Thanks everybody for watching. And listen, Alex Perry is a great man, a great practitioner. He's a gentle guy and a strong soul at the same time. And he's a man's man. He's full of compassion and ability. And if you're being treated by him, consider yourself lucky. He's a great guy. Alex, have a great time at the show tonight.
Thanks, Mike. Appreciate it.
And listen, he's a martial artist. So I want to say this. Just keep a good stance when you're next to your wife. Man.
Thanks, Mike.
You're very welcome.